can get her back in a little bit, but I'm here to kind of take you guys through what I specifically do for a lot of my clients in order to get rid of wrist as well as elbow pain. Very commonly, it can be either due to high velocity sports. So it's like golfing, you tend to get golfer's elbow. People that tend to grip a lot of things like cashiers, or like, let's say if you're mousing all day or picking out files, then you can get different types of elbow pain. And we can't go into all the different diagnoses of elbow pain, right? There's golfer's elbows, there's bursitis, there's lateral epicondylalgia. There's so many different things out there. So I just want to break it down and talk to you about, what sort of things that you can be doing for general wrist and elbow mobility and how the nerves kind of come into play too, right? So I'm going to do my best to do this through a very poor resolution webcam. And so what we want to think about is intrinsic muscles of the hand versus extrinsic muscles. Intrinsic muscles are the hands are any muscles that stay within the hand that don't cross the wrist joint, versus extrinsic muscles are muscles such as like our flexor, some of our muscles like our palmaris longus and some of the muscles that attach directly into our elbow. And what we want to think about is the extrinsic muscles that attach from our wrist and attach directly into our elbow. A lot of the intrinsic muscles of our hands are nerve related, but they are not going to have as much of a connection with the wrist versus the elbow. So what we're going to think about is how we can load or stretch out the extrinsic muscles that attach from our wrist into our fingers and attach all the way up into our elbow. All right, so let's talk about our wrist complex first. And what I want to go through is a couple different strengthening exercises first. So I have a band here, and I have a very typical band. So what we want to do is look at the wrist flexion, right? So when you get and you attach your foot into like a band area, so let's say just like that, I'm going to step onto the band here, and then I'm going to grab on to the edge here, and I'm going to grip it, okay? Now from here, I'm going to contract my elbow by going to some elbow flexion, but I'm also going to go into some repeated wrist flexion, okay? So you can repeat this. I'm going to repeat this for about 10 to 12 times, usually do about a little bit more sets and repetitions on the injured side, okay? And I'm just going to go through one side. We don't need to go through this side at all. Okay. Now, this is specifically more for people with golfer's elbow, people that have wrist flexion issues, and the pain is more on the ulnar side, on the pinky side of their arm. So you're working on flexing the bicep plus wrist flexion. Okay. And if anything, if this is painful, these are called isotonics, which means that like it's a constant load, but it's a consistent speed of the movement. Then you can go into an isometric. So what you do with an isometric is you contract your bicep again, and you just hold in that position, okay? Now these muscles are starting to feel a little bit tired. This is called an isometric, where you're loading the muscles of the bicep as well as the forearm muscles, but there's no movement, and these are called isometrics. Usually I recommend about 20 to 45 seconds of this, do about 3 to 5 repetitions, and what that can do, it can dramatically reduce pain. Isometrics have a very strong pain reducing property, specific to many other joints of the body as well. So another way, so let's say if you're dealing with more lateral elbow pain and it's hard for you to grip things, or let's say you're having pain on the lateral aspect of your arm, more on the outside portion of your elbow, then you could go into some repeated wrist extension as well, okay? Now, repeated wrist extension, remember what I said, is that you can go into repeated isotonics, but you can also go into an isometric and hold that position. And then you can also contract your elbow a little bit more. So I just flex my elbow. And then now these forearm muscles are constantly being loaded. And you can do that for about 20 to 45 seconds. Okay. Difference between this and now band is we understand that bands, the farther you pull away from an anchor point, the more load it's going to be. So if that's too much, right, then you can always just grab an object. For example, I can grab my camera bag. It's about a pound, right? And that's going to be a little bit more forgiving so that when I contract and I do an isometric, it's not going to be as much load in this upright position, right? It's going to be the same amount of load here, 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 here. Anything, it's still going to be the same amount of weight, okay? Versus if you did like more of a band type exercise, then you're going to pull up. And when you pull up, the further you pull it from the anchor point, that's going to be the greatest amount of load, okay? So just to go into some of those movements, okay? Now let's talk about in general, like what are the movements of the elbow? So the elbow has flexion, it has extension, it has what we call, if I don't move the shoulder, there's called pronation, and there's one called supination, okay? especially if you do supination without moving the shoulder, right? Then that's pure supination, and you want to test these out. You generally want about 70 degrees from a T-Rex position. This is called the T-Rex position or the typing position. You want about, normal is about 70 degrees of motion of supination, 70 degrees of motion of pronation, and that's on average the amount of degrees of motion needed in order to be functional, okay? You know, I have about 80, 85 degrees. I have about, you know, 80, 85 degrees here, so I'm completely functional. And an elbow extension is about 0 degrees, and you want to be able to touch your shoulders at about 120 to 130 degrees of motion, okay? Any of those that you feel that are lacking, you want to make sure that you're working on that, okay? So couple ways that you can work on, like, let's say wrist, you know, wrist flexion and elbow extension at the same time. So what you can do is you can get to the floor, and there's a lot of good floor exercises that you can do. So what's a little bit more forgiving on the body here is this. So you can go into a pronated stance. It's called pronation. This is supination. You're going to go into a pronation stance, and then you're going to rock forward. And the good thing about this exercise is you can manage the amount of load that you want to put in. You can self-administer more load by putting more weight into your wrist, okay? Or you can take some of the pressure off. Okay, this is to improve elbow extension plus wrist extension, okay? Very functional coupled movements that you need to work on. And if you want to load that more, then you just go into like a push-up position. So now I'm in a push-up position, and I can rock back and forth. Okay, now let's say you're dealing more of like a golfer's elbow issue, in which you're having more of that inside ulnar aspect of the elbow pain. It's more that it follows the line of the pinky. Then what you could do is you could flip it. Okay, you can go to flip it into supination. Okay, and then you can rock back. And this is still working on wrist extension plus elbow extension. But now it's putting the stress in different areas. Now the stress is on the bicep, it's stretching out the wrist flexors a little bit more. And then also it's working on supination of the wrist at the same time, supination of the wrist and the elbow. There's a great exercise. And again, you can always progress to putting more weight into the wrist and stretching it out that way. All right. Other things you could do are, like, let's say if it's just unilateral and it's just the right arm, then what you can do is you can fixate the arm. And what you can do is you could work on rotations, okay? So I'm rotating the shoulder, and you don't have to rotate the shoulder. You could just rotate the elbow at the same time. So I'm fixating the shoulder, the wrist is fixated on the ground, and now I'm just working on closed chain, supination, as well as pronation, okay? That's to get a lot of the nerves and some of the joints moving about the elbow, especially if you have a lot of elbow pain. Regardless of what type of elbow pain, oftentimes you lock out the elbow and you work into supination and pronation. That can dramatically relieve a lot of pain and a lot of elbow stiffness coming out of the elbow. All right, so other things that I've done is that I call these mobilizations with movement. So if I grab and I put a band there, what the band can do is it can actually gap the wrist joint. And what you can do is you could gap the wrist joint, okay? You fixate the band. You can see I anchored it against here, okay? And I wanna make sure that I step out far enough that it's putting some force against my wrist, and I can rock forward over my wrist this way. You see what I'm doing here? Okay. Usually this is more of a joint mobilization that you can administer to yourself, about 15 to 20 repetitions here. You can also play with a little bit of, again, supination and pronation. You can go pronate, and I'm going to go into wrist extension. And you can supinate, right, which is opening up the palm, and then do the same thing. Okay, and that's just really to gap the joints even more. Okay, so if I were to compare now, like wrist, if you look at that, like if you look at the clear difference, and I feel the difference, my right wrist can go a lot farther than my left wrist right now. Okay, dramatic improvement in just 2 to 3 minutes of mobility. Okay, you can see the difference right there. This wrist is a lot more mobile at this point. This one feels a little bit tighter. Okay, so if I wanted to administer it to my left wrist, I can. Those are some easy, quick exercises that you can do specifically for the wrist as well as the elbow. All right. I think last thing I want to cover, I was just looking at time, is looking at nerve mobility and how the nerves kind of play into your wrist as your elbow. Okay. So the analogy I like to use is it's a big freeway system. okay? You have your cervical nerve roots. It goes from C5, C6, C7, C8, T1, and those are the main nerve roots that come down the pectoral, goes underneath the first rib, underneath the pec minor, and it translates into your arm and provides sensation to your entire arm and also provides motor movement to the arm, right? Okay, so those are called efferent and afferent pathways. And what the nerves do, they communicate with the brain tells what the nerve roots what to do. And then you could tell, and somebody can tell you, like if you're touching the forearm, that sends the signals directly back up. So it's like a freeway system. Think of, these are like the on-ramps, and then the off-ramp or the exit are your fingers. So when people start to get numbness in their hands, or they start to feel like wrist or elbow stiffness, you don't always just blame the joints that are stuck. Sometimes what you do is you can also think of the nerves that have gotten tight. So what you could do here is a couple different things. So like if let's say you're having more of, let's say thumb, I would say thumb, index finger, and middle finger numbness or pain or tightness, then what you can do is you go into waiter's positions and you could drop the food off, okay? And it's very easy to do. And when I do that, I could feel a stretch through my index finger and through the certain areas. And you could bias it too. So if it's more elbow pain, I'm gonna move my elbow a lot more, right? If it's more wrist pain, I'm gonna lock out the elbow and then just move the wrist, okay? So what you're doing is you're getting the nerves from the neck all the way down to the fingers, you're getting those areas to stretch out. You're mobilizing the nervous system, okay? You can do finger flicks, which is one of my favorite ones. You can bring that arm a little bit further back, and I feel a little bit more tension in my fingers. And another way that you could tighten up the nervous system is to side bend. So I can stretch it out, okay? Again, if it's more elbow pain, I'm gonna move my elbow. If it's more neck pain, I'm going to move my neck a little bit more. If it's more shoulder pain, I can elevate and depress my shoulder, okay? And I could also, again, elbow, wrist. So you get what I'm getting at, is that there's multiple joints. The neck, basically think of neck, shoulder, elbow, wrist, as well as fingers. They're all connected, okay, throughout the nervous system. So depending on where your pain is, you could drop the food off like this way. If you're having, let's say, more ulnar nerve pain, let's say you're having more numbness in your pinky or more tightness on this side of your forearm, the ulnar side of your forearm, then you could go like that, and that tightens up the nervous system. So you go into elbow flexion and shoulder abduction, and then you could do movements here. And when you bring your neck away, you're tightening up the nervous system. If you bring your neck towards the painful arm, you're loosening the nervous system. So they call these gliders, where gliders is like you're just getting the nerve to kind of move back and forth. Oh, sorry, I'm going the wrong way. So gliders. And then there's also what we call tensioners, which is you bring the neck away from the painful arm, and then you're tightening up the nervous system. So you think about, instead of gliders, you're actually pulling the nerve apart, okay? So nerve apart would be like this. So I'm bringing that neck away as I'm tightening up the ulnar nerve. And I don't expect any of you guys to get this like right away. You guys could watch this multiple times, but what you want to think about also is just how the nerves are connected directly, like through the fingers all the way to the neck. And lastly, the radial nerve. So if, let's say, you're having any like lateral elbow pain, or you've been diagnosed with tennis elbow, then what you could do is you could go, okay, you could go fist, wrist flexion, elbow extension, pull those arms back, or just unilateral, you could just go that way. And then that would tighten it up. And remember, we can do gliders. So gliders would be like this and go towards the arm, okay? And if you really wanted a good stretch and tense it up, then you can go away, okay, as our arms bring it back. Okay, so I'm going to pronation, elbow extension, wrist flexion like this, and then pull that arm back, okay? I typically get a pretty strong stretch throughout the front side of my palm. Some of you guys might feel it more in your forearm or your elbow. You might feel it a little bit more like in the lateral aspect of your arm. But remember, you can always bias this one too. If I had more wrist pain, I'm gonna do this. Okay, if I had more elbow pain, I'm gonna move my elbow. Shoulder, I can also bring the arm up a little bit to go into shoulder abduction, or bring that arm and to press it down and go into some shrugs. And then again, if it's more neck pain, then I can bring that back and I can just move my neck back and forth. Okay, so as silly as these sound and as silly as these look, these dramatically help people that are always sitting at the desk, that always like sit in certain positions and are starting to feel like hand numbness or hand weakness, or they start to feel like their grip is going out of whack. These are so many important, I would say, self-help tools that you use at the desk. All right, so I hope that this was helpful. I really hope that this was recording, and if not, then I just wasted my time. But hopefully this was really helpful to you guys. If you guys have any questions, feel free to message me anytime on Facebook Messenger. Feel free to leave comments under the Facebook Live, and I'll be happy to answer those. But you know, this was specifically more geared towards those people with like wrist and elbow stiffness, or they sit at the desk a lot and they're starting to notice like, you know, the wrist or elbow is getting stiff, or they start to notice that their hands are going numb. All right, so hopefully this was helpful. Again, reach out if you have questions. Take care, guys.